guys, it's Dr. Denny over at For-Pause Fulshire Veterinary Clinic, and Maddie and I are going to be chatting a little bit more about some frequently asked questions regarding vaccines. So what are core vaccines, what are non-core vaccines, and hopefully this helps answer some questions that you may have about these two different types of products.
Dr. Denny, are all puppy and dog vaccinations necessary?
So I think when we talk about vaccines, we have to remember that as puppies are like human babies. They have maternal antibodies for up to 6 to 7 weeks of their lives. That's going to protect them. But after, up until then, they don't really have their immune system as a baby. It doesn't know what it's doing. So every new thing that it comes into contact with, it has to identify, respond, react. And in the very beginning, when your immune system's learning, that process takes time. And while that time's going on, the pet can get really sick. So the whole reason we do vaccines is to help, prevent disease. And that's a bit of a misnomer, right? Because vaccines aren't 100%. What vaccines truly do is they make sure if you do come into contact with a disease, then it's a shorter, less severe course of disease. And, we might not even see symptoms. Or if we do see symptoms, they're usually very mild. So it's very similar to why you get the flu vaccine. Just because you get the flu vaccine doesn't mean that you're not going to get the flu. But hopefully if you do get the flu, it's going to give your immune system a little bit of a leg up.
What are the core dog vaccinations?
So core dog vaccines is going to be your distemper parvo vaccines. Okay, that's got your distemper, your parvovirus, your hepatitis in there. So it's got your main, what are the most common things that dogs see. So that one vaccine is going to have that in it. Your other core vaccine is going to be your rabies that is required by Texas state law. We do have an endemic population of rabies here. Skunks are rabies carriers, so we do have them. And wild animals, there are cases in Texas every week that are identified. So protecting your pet is going to be really important. But yeah, so your core vaccines are, hey, these are your basics for the most detrimental diseases that your dog can get. And then I bet Maddie's going to ask me next, what are non-core vaccines? Looks like, yep, she's nodding her head. Yes, that's where we're going to head next. So non-core vaccines is going to be more regional. So what is your pet at risk for where you live? So here in Houston, we have canine leptobacteria. So the lepto is a type of bacterium that can live in standing water. It's transmitted by the urine of rodents or wildlife, which we do have quite an abundance of out here in Fulshire. So we strongly recommend the lepto vaccine because of how deadly it is. If your dog or cat catches lepto, it puts them into liver and kidney failure. And the other problem is it's contagious to us. It could put us in the hospital. So by protecting your dog, you're protecting your family. Now, in potentially maybe really dry, arid environments like Arizona or parts of New Mexico, they may not recommend lepto because they probably don't see it. So I consider non-core vaccines, vaccines that it depends on what region of the country you're in. So dogs in Texas may not get the same vaccines as dogs up in New York. We see some Lyme disease down here, but not a ton. So that's another non-core vaccine. But you better believe up in Tick Central, up in Maryland and New York, Colorado, where the deer ticks are, you'll see a lot more of it. So that's a super important vaccine. Now, we do recommend it if your dog's going to be out in the brush going hiking with you, of course. But if you have a pet that's really just staying in your yard and you have them on flea and tick prevention, the risk is going to be low. Same goes for the canine influenza virus. We don't always, we talk about it, but it's not considered core vaccine. Especially right now, it's hard to find the vaccine. It goes on and off back order. Canine influenza can be very deadly, but it also comes in waves across the United States. And I know that when we're not in an active wave out, in central Texas, I generally don't, we're not at risk for it. I do make sure to tell my clients, hey, if there is an outbreak, we do recommend getting the flu vaccine, and then it's on the owner's recognizance to get their pet in. But that's considered a non-core vaccine because we don't see it all the time. So I believe in vaccinating for what we're most at risk for. I don't want to over-vaccinate. We don't want to be giving vaccines that are not 100% needed. But the vaccines are still there to do a job. They're there to prevent disease.
Does my senior dog still need vaccination?
So I believe that they do. There are certain guidelines that we follow. Texas, for instance, does accept 3-year rabies if you meet the qualifying dates of injections, as well as the distemper parvo vaccine can turn into a 3-year vaccine. So I think those are, I think that's great. Less vaccines, fabulous. But we have to remember, as we age, so does our immune system. If we think about what happens with the flu virus on the human side, who's the most likely to get the most sick? It's our older population. Why would we not want to protect our older pets just the same as we would our older human population? It's the same concept. We can see waning immunity. We can see, immune systems that are not as robust as they were when they were younger dogs. A dog that's 2 years old and, healthy and doesn't have potentially arthritis or muscle wasting or liver disease or whatever you can have when you're older, which is everything. That pet, the older pet, is going to be a higher risk if they catch something. So why would we not make sure that they're not protected? I think that's really vitally important. And people talk a lot about vaccine titers, and the problem with that is titers aren't 100%. That just because you have a high titer doesn't mean that you're protected. That only measures one part of your immune response. There's other parts of the immune response that are vital to fighting off disease, and if you are just taking that one little piece of the immune system saying, well, okay, this has a high titer, my dog's protected, that's not 100% true. And it's not true on the human side either. So while I respect owners that want to do titers, it's my job to educate them and to tell you that, hey, we can do vaccine titers, but even if it comes back high, I'm still going to recommend that you vaccinate your pet, because that's only one part of the immune system. That's not evaluating the immune system as a whole. Your dog is still at risk. So I hope this answered some of your questions about vaccines. And if you do have any further questions, please feel free to give the clinic a call. Thanks, guys.